Liz Green's here with Stotzenberger College of Practical Nursing. This video is to demonstrate the injection checkoff. In the checkoff, you will be doing an intradermal injection, a subcutaneous injection, and an intramuscular injection. So to begin our checkoff, you would go ahead and do your sites. So you'd list all your sites for all those 3 injections. Please see the previous video in order to go through your sites. After your sites are done, you're now going to start your checkoff with your 6 rights. So state your 6 rights to your instructor. The right patient, the right medication, right dose, right route, time is now, and document at the end. Then you need to list 4 considerations. So we gave you a list, you just have to know 4 of them. So check expiration date, check the patient for allergies, take a complete drug history, and then educate and evaluate your patient. So there's my 4. Next I'm going to go into my CG wipes. So check my policy and procedures. Am I licensed to do the tasks or get the medications that's prescribed? Check my policy and procedures, I am. So then G, gather my supplies. For NUR 115, your supplies is your med cart. Everything you need should be in your med cart. So I have my cart, I'm good. I got my physician's order, and I got my MAR. So I've gathered my supplies. The next part, I'm going to go into the patient's room to complete. So I'm going into the patient's room. Hi, Mr. Walker. My name's Liz. I'm going to be your nurse today. Do I have permission to touch you? I wash my hands as I come in the room. He says yes. I'm going to ask, can you give me your name and date of birth? We're going to verify it against his wristband. Okay, so 2 patient identifiers. I'm also going to check for allergies. Okay, so I've washed my hands. I've done my 2 eyes. I've identified myself, and I've identified the patient. I'm going to provide safety by putting up my side rails, and privacy by pulling the curtain. I'm going to educate the patient. Today I have for you 3 injections. One is going to be an intradermal injection. It's your TB. It's going to be a skin test on your forearm. The other one's your heparin, which is a blood thinner. It's a sub-Q injection. It's going to be in your abdomen. And then the last one I have is your hydroxyzine, which is an anti-anxiety medication. You said you've been feeling a little bit on edge today. That's going to be an intramuscular injection into your thigh. Do you have any questions? He says no. He's in a safe position. The bed's all the way down. You never leave a room with the bed elevated. Okay? The head of the bed can be up, but not the whole bed. He's got his call light. He's safe. I'm going to wash my hands as I go back out to the med cart. So I'm going to come back to my med cart. My first thing I'm going to do is verify my MAR. So I'm going to take my MAR and compare it to my physician's order. This is not one of your 3 checks of your 6 rights. This is a verification step to make sure that the order got transcribed appropriately. So I'm going to check Terrence Walker, 15461, 15461. I have the right medications. I have heparin, 5,000 units, sub-Q every 12 hours. I have hydroxyzine, 25 milligrams. I am every 4 hours as needed for anxiety. And I have the tuberculin, 0.1 milliliters intradermal, read on admission, and read 48 hours later. Okay, so my MAR is accurate. I am now done with my physician's order, so I'm going to flip it over so I save some workspace. Okay, now I'm going to find Mr. Walker's medication cart as well as the needles that I need. Your needles in this cart are going to be on the bottom shelf. You're going to need one for TB, intradermal, you're going to need one for intramuscular, along with another needle. And then we're going to need one for our subcutaneous injection. So 3 syringes with an extra needle. Okay? Now where's Mr. Walker? Here he is. I'm going to do my first check as I pull the medication out of the drawer and set it on my workspace. So I'm going to start with my heparin. Here is Mr. Walker's heparin. I'm going to do my 6 rights as I check. So Terrence Walker, 15461, 15461. Heparin, heparin. Now this says I need 5,000 units, and this says it's 10,000 units per milliliter. So you're going to have to do some math. Whichever method you want to do it as, I need to see how you got your answer. So I'm going to give 0.5 milliliters. Okay? If you need help with the math, please see Ms. Veronica. So I have the right patient, right drug, and now I have the right dose. So I'm going to give 0.5 milliliters. The route is sub-Q, sub-Q. Time is now. I'll document at the end. My first check for my heparin is done. The next one I'm going to get out is my hydrolysine. So I'm going to verify Terrence Walker, 15461, 15461, hydrazine, 50 milligrams, but I only need 25. So again, you're going to have to do some math. Whichever method you want to do. I know again I'm going to give 0.5 milliliters. So now I know I have the right dose. Route is IM. Time is now. I will document at the end. My last one is my tuberculin purified. This will not have a patient's name on it. This is a universal vial. So, but you still have to check you have the right patient. So I have Terrence Walker, 15461. Now I'm going to check my drug, tuberculin purified, 0.1 milliliters, intradermal. Time is now. I'll document at the end. So my first check on all my medications is completed. Okay, now I'm going to prepare my medications. I'm going to do an alcohol swab, my syringes, and some labels. Okay. I'm going to begin with my heparin. So, I know I need 0.5 milliliters. I have the correct syringe. I'm going to drop 0.5 of air. And then per your policy is whether you wear gloves when preparing medication. I'm going to say no, that it's not my policy to wear gloves. However, you're more than welcome to. I'm going to clean the top of the vial off. And we're going to put our 0.5 of air into the vial. And we're going to flip it over and draw our medication out. Now you might get air bubbles. That's okay. There's some different tricks to get rid of air bubbles. You can flick it while holding it straight up and down like I'm doing and push the air out. You'll see some nurses drop past what they need. Make sure the air is at the top of the syringe, then inject the air out. You're going to have to play with it to figure out how to get the air out of the syringe. So I got my 0.5. I'm going to safely one-handed recap. Now it's a clean needle, so I can recap clean needles. Once it touches the patient, no recapping. Now as I write my label, I'm going to be doing my second check. So I have Mr. Terrence Walker, 15461. I have heparin, 5,000 units. It is a sub-Q. Time is now, and I will document at the end. So the right patient, the right drug, right dose, right route, time, and documentation. I'm going to label my syringe, and I'm going to put my heparin away. Okay. Next, I'm going to pair my hydrazine. I'm going to clean out the top of my bottle, and I know I need 0.5. So I'm going to draw that up in my syringe. I'm going to inject my air. Now, because this is a long needle, you might have to pull it down a little bit in order to get the solution into the syringe. Again, I flick mine to get my air out and draw it past and push the air out. Whatever method's going to work for you. Safely recap your needle. And then at this time, I changed my needle. For an IM injection, you need a new needle to puncture the muscle. Okay, so I've changed my needle. This goes in the sharps. And I'm going to do my second check as I write my label. So I have Mr. Terrence Walker, 15461. I have hydrazine, 25 milligrams. IM. Time is now. And I will document at the end. Okay. So I'm going to label this. And then I'm going to put my vial away. This goes in the trash. Last but not least, we're going to prepare our tuberculin. Okay, I know I need 0.1, so I'll pull that down, clean the top of our vial, inject the air in, and draw out the 0.1 milliliters. Safely recap one-handed, and do my second check as I label my medication. So Terrence Walker, patient, 5461, medication, tuberculin, dose, 0.1 milliliters, route intradermal, time is now. Now I'll document it for you. Now I'm going to put my medication away. Never leave medication out on your cart. So I'm going to take my NUR, my 3 syringes, and some alcohol pads into the room. Okay? So now I'm ready to go into the room. I don't have any medications out. My cart's clean. I'll go see Mr. Walker. Hi, Mr. Walker. It's Liz again. I'm going to wash my hands as I come into the patient's room. I got your medications for you. Is it okay if I touch you? Yep. Alright, I need to verify who you are. Name and date of birth, please. Thank you. Verify my allergies. Okay. I'm going to get some gloves on. Okay, do you have any questions, Mr. Walker? He says no. Alright, well, before we give your injections, I'm going to do my third check. So I'm going to come over to my table. Set up so you guys can see. And I'm going to do my third check on my medications. So I'm going to start with my heparin. You're checking your 6 rights. So, patient, Mr. Walker, right drug, heparin, right dose, 5,000 units, route sub-Q, time is now, I will document at the end. You need to state all 6. Same thing for my intravascular injection. I have Terrence Walker, right patient, right drug, hydralazine, 25 milligrams, IM, time is now, document at the end. Then for my TB, I have Terrence Walker, tuberculin purified, 0.1 milliliters intradermal. Time is now, I will document at the end. Okay, so now we're going to go ahead and give the injections. Our 3 checks are done. I'm going to get my little prep pad. It's okay to move to the prep pad at this time, okay? On the patient, you've already identified all your sites. So now you just have to tell your instructor which site you're going to do, okay? So I'm going to start with my intradermal, my TB. The site is on my forearm, 3 to 4 fingers above the wrist, 3 to 4 below the antecubital space. You're going to assess your site. You're looking for redness, bumps, bruises, irritation, scar tissue. We're not using that site if it has any of those. Okay, we clean our site in a circular motion. You do not blow on it to dry it. You do not fan it to dry it. That's just spreading germs. Okay, for the intradermal injection, it's bevel up. It's a 5 to 15 degree angle. We're going to spread the skin, and we're going to do that 5 degree angle into the skin, and then inject. It will make a bleb or a bubble, and then pull your needle out. Okay? Now I'm going to safety lock the syringe and put it in the sharps. You never recap a dirty needle. Once it touches the patient, it's dirty. Okay, so I'm going to instruct the patient, do not rub the site, touch the site, massage it, leave it alone. If he has any issues, to put the call light on. Okay, my next site, we're going to go give his heparin, sub-Q site. I'm going to use the abdomen, 1 inch away from the umbilicus. So, I assess my site. It's free of the bumps, redness, bruises, scar tissue. It looks great. Clean it in that circular motion, inside to out. The method is pinch, poke, release, inject. Okay, if I can pinch an inch, I do 45. If I can pinch more than an inch, I can do a 90 degree angle. I'm going to say I can only pinch an inch. So I pinch, I poke, I release, I kind of walk my fingers back up, and I inject slowly. And then I take the needle out, This does not have a safety device on it, so it goes directly into the sharps container. Okay? I instruct my patient not to touch it, massage it, rub it, leave it alone. If he has any issues, to let me know. Okay? My last injection, my IM injection. We're going to go in the vastus lateralis. I'm going to assess my site. Any redness, bumps, bruises, irritation, scar tissue, we're not using it. Site looks good. Again, we're going to clean, that circular motion, inside to out. You would have a new prep pad for each site. Okay. With the IM injection, we're going to a 90-degree angle. We're going to use the Z-track method. With Z-track, we pull the skin and the tissue down or laterally, go in at a 90-degree, kind of like a dart, and then we aspirate. We aspirate because we're checking to make sure we're in a muscle, not inside a vein or a vessel. If we are, that's considered intravenous medication. We don't want to give this intravenous. Okay, so I aspirate. I don't see any blood. So I'm going to slowly inject. Wait 10 seconds. And then as I pull my needle out, I'm going to release with my other hand. And then this safety locks and goes into the sharps. Again, do not recap the dirty needle. We're going to instruct our patient, don't massage it, don't touch it, leave it alone. If he has issues, to go ahead and put the colloid on and let us know. Okay? So how are we doing, Mr. Walker? Mr. Walker's doing good. He's in a safe position. I'm going to take my gloves off, wash my hands, and go back out to chart. Okay. So I'm going back out to the med cart to document what we did. If you didn't document, you didn't do it. So I'm going to cross off the time I gave it and put my initials down, and then I'm going to write in the time for the other two medications. Crossing them off, putting my initials in. Also in the box, you're going to put where you gave it. So heparin, I gave in the right abdomen. The IM injection, I gave in the left thigh. And then the TB, I gave in the right forearm. And then I'm going to sign the box down here and put my initials. Now on your signature, you have to identify what credentials you have. So I'm an RN, so I put my name with RN following it. You guys are Stotzenberger LPN students, so you're going to put student LP, student nurse, okay? So then I have this filled out. I'm going to wait about 15-20 minutes, then I'm going to go check on my patient. Okay? So it's been that long. Wash my hands. We're going to go check on our patient. Hi, Mr. Walker. It's Liz again. How are you doing? He says he's doing good. I'm going to check to make sure he's not having a reaction to the TB, that there's no bleeding noted from the heparin, and that his anxiety has calmed down. Okay? He says he's doing good. He's in a safe position. Bed is all the way down to the ground. He can keep his head in the bed up if he wants. He's got his colloid. I'm going to wash my hands as we conclude the checkup.